All right, today we're going to talk about survivor benefits, widow benefits, widower benefits. It's called several things at Social Security. We're going to find out who can receive those benefits and how much and how to apply. How do I know? I've taken hundreds of thousands of survivor claims. When I worked at Social Security Administration, I ran the third busiest office in the country, and now on my semi-retirement, my mission is to make sure y'all get everything you're entitled to and teach you how to navigate the bureaucracy. All right, so this is also a live Q&A. So after we talk about the topic of survivor benefits for about 10 or 15 minutes, I'm going to open it up. It looks like I already got a bunch of questions. So if you got any particular questions because of Social Security, there's exceptions to the exceptions to the exceptions. So let's make sure you and your family are getting everything you're entitled to. Just click the chat and put in your question. If you're watching this on a recording later, make sure you subscribe. And that way you can find us when you do have a question. What we are finding here, I've been doing a lot of lives and talking to a lot of people, millions of people throughout the country, and too many people are not receiving the benefits they're entitled to. Why is that? Is they're getting incorrect information, either through social media. A lot of people out there think they're Social Security experts because they participate in a two-day seminar and now they're Social Security experts. And unfortunately, Social Security, even after months and months of training, some generalists at the Social Security Administration are giving out incorrect information, and because of that, people are not receiving the benefits they're entitled to. So let's make sure that is not you and your family. Okay, let's jump right into it. So married, in order to get survivor benefits, so we're talking spouse benefits. So there's regular spouse benefits when your spouse is living, and then there's surviving spouse benefits. And so that's what we're talking about today. In order to get those, you have to be married to the deceased. If you were married to them when they passed, then all you have to do is be married to them for 9 months. There's a lot of people out there that are entitled to benefits and they think, oh, they had to be married to the person for 10 months. I was married to him. He passed away after a year or two or whatever the case may be. No, don't have to be married for 10 years. If you're divorced, yes. If you divorced from an individual and they have since passed away, then yes, you had to be married to the person for 10 years. And don't you see there's exceptions. 20,000 pages of Social Security policy. Read it a few times, unfortunately. And so the exceptions on the 9 months is if you were married to the person and they passed away because of an accident, then doesn't necessarily have to be 9 months. If they passed away in the line of duty in terms of the military, line of fire, line of duty, when they're active duty, then that's an exception as well. The 10-year marriage, I get questions all the time about, well, we were married 9 years, 11 months, and 29 days. Does that qualify? Unfortunately, no. It has to be 10 years, but there is an exception. You can actually marry one person and be married to that person for 5 or 6 years, get divorced, and if you remarry the same person by the end of the next calendar year and then married another 5 or 6 years to equal 10 years, Social Security can add those 2 times together. And you're saying, how many people do that? Well, I looked it up. 5% of Americans remarry the same person. So there you go. It has to be the same person. All right. What about, there's also children benefits available. So if you have a deceased parent, children can receive benefits on those records. And there's also called, a lot of people miss, it's called child in care. If you have a child under the age of 16 or one that became disabled before the age of 22, then the other parent that is essentially kind of staying home or limited their income are eligible for benefits on the deceased's record. I've done a few videos on that. I'm just kind of going over overview of all of these to try to get the information out there. One thing that you can do when you're receiving surviving spouse benefits is that you can actually choose. This is something you cannot do if you're filing for spouse benefits on a living spouse. So if you're filing for survivor benefits, you can actually choose. Survivor benefits start at 60 years old, and you can choose. So you can say, hey, I want to go ahead and start my survivor benefits. Or if you're 62, now you're eligible for benefits on your own record. You say, no, I don't want to file for benefits on my own record. I'll hold off on that. That's something you can't do. You cannot do if your spouse, divorced spouse, is still living. But a survivor benefits, you can. So at 62, you can say, no, I'm just going to go ahead and take survivor benefits. And I'm not going to touch mine because mine will increase every month until I hit 70 years old. So a lot of people do that. That's a good strategy. Unfortunately, a lot of people don't know about that strategy and they lose money for the rest of their lives. So you can pick benefits on your own record, wait for your survivor benefits, pick survivor benefits, wait for your benefits on your own record. There are different variables depending on the amounts of each and whether you need the money right now or whatever. One thing that Social Security is unfortunately kind of dropping the ball in is they're telling people when people call Social Security and they want to find out if they're entitled to benefits on a divorce, particularly a spouse or divorced spouse benefit record. They in order to do that, you had to be married to the person. If it was a divorce, 10 years and everything like that, and their benefit amount, the spouse's benefit, divorce spouse benefit, has to be twice yours. Okay, more than your full benefit amount. And what's happening is people call and they say, "Hey, is there any more money? Or is my divorced spouse's benefit amount twice mine, so I can get some spouse benefits?" And the Social Security employee says, "No, you're not entitled on that record." And they had the 10-year marriage and everything like that. And what they mean by not entitled is the benefit amount is not twice the amount. So what's happening are those people are going out through the rest of their lives and they think, well, yeah, I checked that. I'm not entitled to any benefits on my ex's record. That's only because of the benefit amount. When you're filing for living spouse benefits, the other record has to be twice the amount. But when you're filing for survivor benefits, if it's $1 more, you can get that $1, depending on how old you are and everything. So there's a lot of people out there, probably someone relatives, coworkers, next door neighbor or something, go out there and say, "Hey, I know you need some extra money. Weren't you married to someone and they have since passed away?" "Yeah." "Well, have you checked to see if they're entitled to any benefits on there?" "Oh, I called a few years ago." "And well, when did you call?" "When he was alive." Or he or she was alive. "No, no, call again." And they just might be eligible for more benefits. So not being entitled at a particular time does not make that person not entitled forever, because the situation changes from 50% up to 100%. And a lot of people don't realize that you can collect on a previous spouse. They they think that, okay, if you were married to, spouse number one for 10, 15 years or whatever, and then remarried, divorced and remarried, and then now are since divorced, people think that you can't go back on the first one. A lot of people out there are missing money. Yes, you can. Social Security, when you go in to file a claim for survivor benefits or spouse benefits, um, I've done this hundreds of thousands of times. I say, "How many times you were married?" "3 times." "Any of those marriages last 10 years?" "Yep, they were all over 10 years." "Okay, let's go down through the list." That's ex-spouse number one, ex-spouse number two, ex-spouse number three. Oh, looks like number two is the winner. That's the higher benefit amount. Let's go ahead and get benefits on that record. Doesn't matter if you've been remarried, as long as you're now single. However, in terms of remarriage, you can remarry after the age of 60 when you're receiving survivor benefits. They changed that law many years ago, a few decades ago. It was the living in sin law, where you could not get married if you were receiving survivor benefits. Congress says, no, you cannot get remarried. And then, so a lot of people said, well, I found someone, we're living with them. We'd like to get married, but I lose benefits. So they changed the law. They said, okay, after you're 60, we don't want you to live in sin. That's really what they called it at the time. So they allowed people to get remarried. So now you're able to get remarried after the age of 60 while you're on survivor benefits. So there's that. So you don't lose those benefits. You can also receive disability benefits. So if you're currently receiving disability benefits and you're about to turn 60 years old, check to see if you're entitled to any survivor benefits. You can collect disability and continue your Medicare and add survivor benefits on top of that if there's any more money in there. Okay, let's talk about the money, how much we're talking about. For children, if a child is receiving benefits from their parent and their parent is still out there alive and kicking, then the child receives up to 50%. If there's a bunch of kids on there, then it's kind of divided. That's why it's up to. But if you only got one or two children, then they each reach 50% of the parent's full benefit amount, their PIA, their primary insurance amount. Once the parent dies, children are entitled to 75% of that benefit amount. Spouses, current spouses, Divorced spouses are entitled up to 100% of the benefit amount. So it really depends. The survivor benefits are kind of difficult to kind of throw out a blanket statement because it really depends on whether the deceased spouse had filed for benefits, if they hadn't filed for benefits, or they were receiving disability benefits, or whether they received benefits at their full retirement age, or if they filed after their full retirement age and were receiving delayed retirement credits. Delayed retirement credits is when you wait to file your benefits after your full retirement age, and you get 8% per year added to your Social Security check. So if your Social Security check is $1,000 and you wait until 73 years after, you get $1,240. So current spouses, living spouses, are not entitled to those delayed retirement credits from a spouse, but surviving spouses are entitled to those delayed retirement credits. So if you're your full retirement age, it really depends also how old you are when you start those survivor benefits. So it depends on how old you are when you start survivor benefits and the deceased spouse when they filed. So a little bit wonky computation there, but in particular situations, join the live Q&A and we'll kind of go through there and I'll teach you the best strategies to make sure you're getting everything you're entitled to. And one final thing, I want to tell you a story. Again, I've taken hundreds of thousands of survivor claims, and the one that was like super, super memorable was this lady came in. She was 83, early 80s, and her husband had just passed away. And she came in with a big binder. She called it her Book of Love. And her husband had put this together, and it had everything in there. When someone passes away, I've again done this so many times. People are kind of shocked and depressed, and and overwhelmed by the bureaucracy. But her husband had put a book together, a binder together with everything, the wills and his DD 214 from the military and the mortgage stuff and the credit card stuff, and everything was in there. So it was all in there. And the guy even put little messages in there because he knew that if she was looking at this little pocket of information, then he probably wasn't there anymore. So he put little notes in there. So that was kind of do that. If you've got someone that you want to take care of, go down to wherever office, whatever, and get one of those big old three ring binders and put all that information in there, put it in a safe location. That way, if anything happens to you, your loved one doesn't have to deal with another issue in their life after your passing. And another person, kind of last one here, and then I'll get into the live Q&A. Another person, they put some money away rather than having kind of a solemn funeral and everything. The guy put a bunch of money away and says all his best family and friends and stuff gave him a trip to Hawaii. So I don't know if you do a trip to Grand Canyon or something like that. So it's like, yeah, I'd grieve for me for a few minutes, but y'all go have a great time. Here's money for tickets and everything like that. So I thought that was a pretty awesome way to hopefully he did it before he also passed away. Okay, all right, so that's enough. Let's get into, so if you have any specific questions, like I said, exceptions to the exceptions, please make sure you ask, and I'll get to as many questions as I humanly can within the next about 45 minutes. All right, let's see here. Cecilia, good afternoon. I am receiving my widow's benefits. If I got a full-time job, can I put my Social Security income in standby, or will I be without this benefit and apply again when I decided not to work full-time? Okay, good question. So I didn't talk about work, so because I saw your question up there first thing. Thank you. So yes, with spouse benefits, survivor benefits, retirement benefits, all of it, there's work limitations if you get those below your full retirement age. If you're full retirement age, then doesn't matter anymore. Social Security doesn't matter, doesn't care about your work. There's no withholding of $1 for every $2 you go over. So if you're receiving widow's benefits, you're limited. This year it's $22,320. Anything over that, Social Security holds back $1 for every $2 you go over. So if there's a couple of strategies. Some people just say, well, I'm not going to go too far over, and I don't want to go ahead and stop my payments, and because sometimes Social Security messes it up and it's hard to restart and it turns into a nightmare. But if you're only going over, $1, $2, $3,000, some people just say, I'll just go ahead and do it. And then what happens is next year when you file your taxes, You tell the IRS, your buddies at the IRS, what you made. The IRS tells Social Security, and Social Security looks at it and says, "Oh, Cecilia made $2,000 over what she was supposed to. She owes us $1,000, $1 for every $2 you go over." And they send you a nice little nasty gram that says, "Hey, Cecilia, you owe us $1,000." So at that time, you're like, "Yeah, yeah, I knew I was going to do it. So here's the money. Cut the check." Or you can set up a payment plan, interest free. So some people do that. Or if you're going to make considerably over, then you just call up Social Security and do a work report and say, "Hey, I'm receiving early retirement, survivor benefits, spouse benefits, but I'm going back to work. I'm going to be making, $100,000 or whatever." So they'll stop your benefits, suspend your benefits, and it'll be continuing suspense. So if you make 100,000, if you tell them you're going to make $100,000 this year, and next year they'll just kind of continue that until you tell them otherwise. So, and then once you don't necessarily lose those benefits, what happens is once you hit your full retirement age, it's called ARF, the adjusted reduction factor. Once you hit your full retirement age, Social Security looks at those months that you did not take Social Security benefits and they recalculate your benefits. So basically, how it works is if you were receiving 30 months early, again, retirement, spouse, survivor, it's all the same. If you were receiving your benefits 30 months early, so you were receiving essentially a 30-month reduction in benefits. But then you only take 10 of those months and you don't get a check for 20 months because you go back to work. Once you hit your full retirement age, Social Security computer system automatically, you don't have to do anything. It automatically looks at your work record and says, "Hey, we're reducing this person by 30 months, but they only took 10 checks." So it automatically calculates, and from then for the rest of your life, then it's only reduced by 10 months. So that is 100% automatic. So, all right. Katie, can't wait. You always give out information. Oh, I appreciate it. What does it mean when you say they say it's the queue for the widow pay? It's the queue for the widow pay. Not sure. Not sure. Dr. Ed, everyone, I have a TRICARE. Would you recommend for me to sign into Medicare? If yes, which part? Thank you for all you do. You're welcome. Yeah, for TRICARE for Life, they make you sign up for Part A and Part B. So you have to sign up with them. Triple check that with them, but I'm sure they make you sign up. In terms of other, I definitely 100% would not get a Medicare supplement plan, the N and the G, because TRICARE is essentially your Medicare supplement plan. What some people do is they get a Medicare Advantage plan, particularly one that pays part of your Part B premium. So you kind of have your cake and eat it too. And you might get some gym membership and some extra dental and stuff like that. So some people do that when they have TRICARE, some people don't. So if you want help with that, because it is this season for Medicare. So I've got a partner there, Chapter Advisory. They check all the plans in your area. And so you can give them a call and tell them Dr. Ed said hi, and they will take care of you and go through all the plans and all your options, 100% free. So they can help you out. Let's see here. Which Part D or G is best in Southern California? Thanks. It really depends. D is it 100% depends. Nobody can tell you which one is the best for you because number one, it changes every year, and your prescriptions. With Medicare Part D and Medicare Advantage, people say, "Oh, my next door neighbor has this, and they really like it." Well, that might be great for your next door neighbor because your next door neighbor has different doctors and different prescriptions and different needs. But for you, that's a terrible plan. So it really depends on your particular situation. That's why it's good to have someone kind of help you navigate, particularly when they don't charge you anything. So that's always a beautiful thing. G, that's an easy one, whichever one's the cheapest. So Medicare Supplement Plan G and N, pretty much whichever one's the cheapest. One caveat to that is there's some like local plans throughout the country that kind of give you kind of a teaser rate. So they're the cheapest, but they're also like a really small company, you probably never heard of, the East South Texas Firemen's Medicare Supplement Plan. And, I'd probably stay away from that, even though it's cheaper, because they get you in there and it might be difficult later to switch because of health reasons. and then they start jacking up the rates. Or yeah, so I would go with the least expensive, kind of nationally known big plan, Medicare supplement, Plan N or Plan G. That's the one I would go for. Yep. What form should SSA send me to complete the auxiliary child benefits? No form. It's completely done on the online, or excuse me, over the phone. So yeah, if you're already receiving retirement benefits or disability benefits or survivor, whatever the case may be, then yeah, just call up and schedule an appointment and tell them you need to take an aux child claim. And so if it's sounds like it's just one child there, they'll be taking two claims. It'll be, you have to provide probably the the birth certificate of the child to prove the relationship. And so you'll take the claim, and you'll also take what's called a representative payee application. As if the child can't take care of their own benefits, if they're not like 17 or 18, then someone has to be appointed to take care of the benefits. So yep, it's called the 800 number. And yeah, you don't need a form for that. There is a form, but nobody uses it. So I've been told something different from everyone I speak with. Yeah, this is par for the course. I was married 32 years and divorced 12. I will be 70 on the 7th of November. I was told I can't get his Social Security until he dies. Is that true? Yeah, so probably that's what I was talking about. Um, so it sounds like the Social Security employee told you the second part. Often you call them up when your ex is alive and kicking, and you say, "Hey, am I entitled to any benefits?" And the Social Security employee looks at the numbers, the amount, and because there's his or her benefit amount is not twice yours, they say, "No, you're not entitled," and then they hang up, and that's what you've got in your brain for the next decades. But it sounds like your Social Security employee you talked to did the right thing that says, right now, no, because benefit amount is not enough. But if he should ever pass away, yes. So that sounds correct. Um, Again, that's 99% of the time, that's exactly what happens. So that sounds correct. But I would, some people don't keep in touch with their exes, and so they don't know what happened to them or whether they're still alive and kicking or whatever the case may be. For those, I would just recommend, once every 6 months or so, call up Social Security and say, "Hey, hey." um, if you don't have that person's Social Security number, then just provide give them the person's name, date of birth, as well as the place they were born, and the Social Security employee can find the Social Security number. And they won't give you the Social Security number. They won't tell you the amount until you prove that you had a relationship with this person by providing the marriage certificate and the divorce decree. But they'll tell you, "Yep, there's money there, so let's schedule an appointment." So as soon as they say, "Let's schedule you an appointment," that means yay, money. So, but sad, somebody passed away. So I guess, yeah. Anyway, let's see here. Spouse. Forgive my memory as I am no longer 50-ish. Is Derek still part of your team network? He has offered me an advantage plan that sounded good, but I would have an increase in my monthly premiums. Yeah, the previous company I was doing with still good. I'm still we're still partnered. But there are just so many people being canceled this year, and this year is the craziest, most chaotic time for Medicare Advantage, Part D plans since probably day one. So we needed a lot. I needed a lot more people to help out people. A lot more people are requesting help. So yep, Derek is fine. But if you want to switch and talk to my new people, then that's fine too. Yep, either of them can help you out. I only pick the best people. And please, if you call up and you don't receive awesome customer service, please let me know. That's always been my big thing, is taking care of people. It's an old Marine Corps sergeant in me. I won't make you do push-ups or anything. I'm nearing my full retirement age. Oh, let me pop this up here. I'm nearing my full retirement age and thinking of retirement. Do we get the increases on Social Security even if we are not in retirement? Yeah, the COLA increases, the cost of living allowance. Yep, absolutely. Those are automatically put in there. Uh, so, yep, they're put in your estimates and everything like that. I'm all set with my Medicare Advantage plan for next year. Thanks to Kim. Thank you, Dr. Ed, for providing your service. Awesome. Good deal. All right. Good deal. Glad to hear that. So if he dies of natural causes and we're married 7 years and collecting SSDI, do I get survivors pensions? Okay, so he and we're married 7. So if you were married to him when he passed, you just had to be married 9 months. I hopefully I put in my little thingy, did I put 9 years or yeah, 9 months. Yeah, 9 months. Okay, I thought maybe I made a mistake and but no, yeah, it's yeah, if it's a divorced case, if you were divorced from this person, you had to be married 10 years. So, but if you were married to the person and you were married to them person for 7 years, you're good. You can collect a survivor's benefits. Yep. Let's see. Is there any difference in benefit type if we file for disability for our 17-year-old, or should we wait until she is 18? Can she get our benefits? I would definitely start the process because unfortunately the process is taking forever and a day now because of the low staffing and everything. So if your child is disabled, I would get that process started. And depending on everything and how long it takes and the birthday and everything like that, but there is a difference. But anyway, I mean, if the child is under 18 years old and you're receiving benefits, retirement benefits or disability benefits on your own, then the child is automatically entitled, period. Um, but if the child was disabled before the age of 22, yes, once they turn 18, there's different kind of disability factors, eligibility things that they do look at. So at that time, yeah, you might have to switch from a regular child, receiving benefits just because they're a child, to a child, a disabled adult child, based on a disability. But that's just a bureaucratic thing. You shouldn't worry about that. You should just go get your money. So let Social Security worry about that. I'm on Social Security disability and have Medicaid and heat assistance, etc. I'm due an inheritance. My dad passed away. How can I avoid losing my extra state assistance? Yeah, there's special needs trusts. There's ABLE accounts. They just raised the age on that one. Definitely check out those. So yeah, if you have a substantial inheritance because Medicaid is a welfare-based program, then yeah, the SSDI, no relation whatsoever. So if you're receiving SSDI, Social Security Disability Insurance, you can have $1 billion in the bank, no problem whatsoever. But if you're receiving SSI, the welfare-based benefit, then yeah, that's a totally different thing. Sharon, I was on SSDI from 45 and automatically switched over to SSA at 66. Do I have to wait for him to retire to get his benefit? No. Yeah. So this is, thank you, Sharon. When you're on Social Security Disability Insurance, once you hit your full retirement age, they switch it from disability insurance to basically just regular retirement. The check stays the same, direct deposit stays the same. People don't even recognize the switch. It's just more of a bureaucratic thing. But the good thing is you're, no longer have continuing disability reviews, you no longer have work limitations. But in terms of no, you do not have to wait for him to retire. It's called Independently Entitled Divorced Spouse Benefits, a nice little long acronym, IEDS. As long as your ex is 62 years old and his benefit amount, it sounds like he's still alive and kicking. If his benefit amount is twice your full benefit amount, call up 800 number and schedule an appointment immediately, if not sooner, and tell them you want to file for IEDS. Again, he has to be at least 62. It doesn't matter whether he has filed or not. I think I talk about the independently entitled divorce spouse benefit every time I do a live Q&A because so many people are losing those benefits. I know everybody here. I know someone in your orbit. It's kind of the 7 degrees of Kevin Bacon type thing. If it's not in your orbit, then one orbit removed, someone is not receiving the benefits they're entitled to, and so please let's help them out. So yes, you should have. I mean, hopefully you haven't been waiting too many years and been getting incorrect information. If he turned 62 3 years ago, you could have gotten benefits 3 years ago. So yeah, hopefully. My new name for you is Dr. U Rock. Thank you. I appreciate it. 2 questions. If I travel to a new country or state within the US, will my Medicare supplement plans follow me? Is dental and vision correct? Yeah, that's a great thing about Medicare supplements. You can go anywhere in the country. As long as the doctor takes Medicare, you're good. And there's the doctor accepting new patients, but that's with everything, right? But yeah, as long as they take Medicare, you're good. But obviously, a new country, not necessary, but some Medicare supplement plans do have limited overseas emergency coverage. So we're talking Medicare supplement, not Medicare Advantage. Even some of the Medicare Advantage plans, if it's an emergency, it's emergency, go for it, anywhere in the United States. But some Medicare Advantage plans have kind of what they call kind of a passport. So if you live in, Florida or something like that, 6 months of the year, and then, Michigan the other 6 months or something, they have kind of a passport-like thing. Sometimes you have to call them. It depends on your particular company. And you say, hey, I'm going to be in Michigan for 6 months during the winter because you reverse snowbird or whatever. And you can use that particular company's network in Michigan. And then, so if you do something like that, make sure you find a Medicare Advantage plan that has that option. Dental and vision, no, Medicare supplements do not cover dental or vision. When you get a Medicare supplement plan, you get, obviously, you have Part A, Part B. You have to pay the $174.70 for Part B. And then you get a Medicare supplement plan, either an N or a G, or maybe an F, depending on your age. And that has a monthly premium. And then you have to get a Part D plan, a prescription drug plan. And people say, well, I don't need it because I don't take drugs. If you get it later, you're going to be penalized for the rest of your life. So you really, really need to get it. And then if you want dental and vision, you have to get a separate dental and vision plan because it doesn't come with that. Medicare Advantage plans, they come with almost all that wrapped up. There's zero premium. They come with some level of dental, vision, and hearing. And a Part D plan, 90% of the time, they already have Part D plan wrapped up in there. But those are the ones with prior authorizations and networks and pay-as-you-go type system. So it really depends on your particular situation. Nobody can tell you which one is best until they talk to you for a while. Kim was able to get Part B canceled for December 1st. When reapplied, do I need to also fill out the form L564 if I am an IEP and work ends? Yeah, if you're still in your IEP, you should be good. So you canceled your Part B because you had other health insurance. I remember, Kim, because you had other health insurance from work. But it's kind of more of a, well, I forget what your IEP or SEP, but because you had health insurance from work, you had 8 months to sign up for Part B and avoid any of the penalties. But I think Kim just, Social Security messed up and signed her up a month early. So she still had time. So, yep. If you're still in your IEP or SEP, then you don't need to fill out the 564 or the 564. You still need the 40B, that's the form to actually file. So I have 2 houses. Hopefully I was clear on that. I have 2 houses I rent. Does that count on earned income if I choose to receive survivor benefits? I am over 64. Nope. Unless you are a realtor and that's your job, that's your business, is to rent houses and stuff like that and sell houses. But if that's your part of your own personal kind of retirement income type thing, nope, doesn't count as earned income at all. I am getting calls 10 times yesterday to sign up for Medicare Advantage. What can I do to stop them? I on Medicare Part getting for 3 years. Yeah. Tell you the best way to do it is pick up the phone and play around with them a little bit and say, oh, which company do you suggest and what's your name? And you find out their name and the company. It's probably the same big companies. And you call that company and says, hey, I didn't give this person permission to call me. And yeah. And if they get too many of those, they'll lose their contract with that little. So as of October 1st, this is awesome. I love this. Government can do something. The government, or particularly CMS, the Center for Medicaid Services, said you have to have one-to-one permission, consent. So if Ed, coincidence, all Eds hate annoying calls. So nobody else does, just us Eds, right? Anyway, so if Ed gives John in Topeka, Kansas, permission to call about Medicare, then John from Topeka, Kansas can call, or John's company. Um, but what's happening, what it has happened up till September 30th, well, it's still happening, unfortunately, because there's bad players, actors out there, um, is John in Topeka, Kansas calls Ed. Ed doesn't want to enroll in that plan. John just lost the money for advertising, so he sells Ed's name to everybody in the country, and everybody in the country starts calling Ed. That was supposed to end on September 30th, but unfortunately, there's a lot of Medicare people out there, insurance agents, brokers, that don't do the right thing. So, for us, chapter in my company and everything, which my company is me and my son, but we partner with a chapter. If you don't call it, you have to call us. I get emails all the time. Hey, can you call me? Well, not really, because for Medicare, my partner's chapter, and I cannot tell them to call you because you have to tell them to call you. I cannot do that as a third party. So yeah, this is great. But unfortunately, it sounds like it's not working yet. So we just need to get those bad actors out of there. And that's one way to do it, is just drop the dime on them, I guess, right? Thank you for your help and all you do. Made my life less crazy or thrilled. Oh, awesome. Appreciate it. Yeah, they use spoof numbers. Yes, yes. Yeah, a lot of those are overseas and stuff like that too. Yeah, so yeah, we just it'll take for a while. Hopefully, I think the commercials have definitely been reduced. That's another thing that the government did, says, like on those grocery cards that they were advertised, they do exist, those extra over the counter and grocery cards and stuff for Medicare Advantage plans. Those do exist, but what people were doing is, health insurance companies and everybody, they were taking the best one in the country and then advertising it to the entire country, like everybody in the country could get it. And then when you call them up and they say, oh, well, you don't live in Paris, Texas, so you can't get it. But then they do the hard sell and try to sell you something else. They can't do that anymore, because that's what they call pretty much bait and switch, right? So yeah, Medicare, it's taken them years to finally take action, but they should have done that years ago. But hey, better late than never, right? Fatima, I have gotten approved for SSDI. Oh, great. How much monthly would my 3 kids get as my dependents? My 4-year-old daughter lives with me, and my 2 sons, age 12 and 17, all live with their mothers. So yeah, they are. If those are your natural children or adopted children or whatever the case may be, they are entitled to benefits on your record. So basically, it sounds like it's going to be a family max. So each child is entitled to 50% of your full benefit amount. So your PIA, your primary insurance amount. But there's also a family max. So this definitely sounds like it's going to take place, since you have 3 kids. So it's basically, the family max is, like, let's say there's $5,000, and I won't get into the calculation. The Social Security, as soon as you call up Social Security, they'll run the numbers. But it's basically like, say for instance, the maximum that can be paid out to your immediate family is $5,000, and you're getting $2,000 of that. So there's $3,000 left over. If you got 3 kids, each will receive $1,000, right? You got 4 kids, they'll divide it again. So that's how that works. So call them up, and yeah, and they'll tell you what the family max is. And remember, so in term, oh, let me, so your 4-year-old daughter, so you can go ahead and with me, and 2 sons, age year old, live with their mothers. Okay, so for the daughter, you call up and schedule an appointment to take your daughter's claim, and they will do the representative payee and make you the representative payee. For the other 2 children living with their mother, tell the mother to call up Social Security, because she will have to file for the benefits, because she'll have to be appointed the representative payee. So yeah, make sure you reach out to her and tell her to go ahead and file. And yep. How much does it cost to get a personal phone call? I had multiple issues with Social Security making errors. The people that I spoke with in the office or on the phone have given me information. Yeah, you can just click on, I think I have, let me see, click on the QR link there, and it'll take you to my little link tree thingy, and it'll say one-on-one, was, oh, private call with Dr. Ed. So just click on there and it'll give you all the information and see if there's any appointment available. I do a few limited appointments. 99% of my help is free, but in order to pay for the phones and all that kind of good stuff, I do charge for something. But most of the questions, most of the questions I answer here. My full retirement age is next June. If I file for Social Security prior to that in 2025, what is the limit I can earn up to June 1st without being penalized? Your full retirement age, so that the year you turn your full retirement age, it gets to like what the new numbers for next year is 60. Let's see here. I've got the new fact sheet for 2025. It hasn't got the Part B, but so for next year, $62,160. So as long as you're below that in the first 5 months, you're good. Anything over that, they hold back $1 for every $3 you go over. So this year it's $22,320 because you're not your full retirement age this year. But next year, the year you hit your full retirement age, your ability to earn triples. So you're probably good. So yeah, it's good to start your benefits. Most people, once they hear the numbers, it's like, okay, it's like 5 months early. I don't want my benefits to be reduced for 5 months. But then you find out, wow, that's only a $50 reduction, but I get $10,000 ahead of the game. So yeah, sign me up. I have an appointment Monday with your Medicare team. I'll let you know how it goes. Perfect. Thank you very much. Yes, yes, yes. I've had just 100% glowing response so far. So story would make a good book. Yes, please. That was awesome because I've seen too many people come to kind of, they're already stressed out and everything enough when they lose a loved one and they come in, they don't know, what do I do? And, he or she always took care of this stuff. And do I need a death certificate? I don't know how to get a death certificate. I don't know what happened to his birth certificate. It's due to 14 and all this, it's overwhelming. So anything you can do to kind of lighten the load. All right. Okay. I already answered that one. Good afternoon. Why does everyone try to sign us up for Advantage plans instead of personal supplement plan? If you've been watching my channel, I prefer Medicare supplement plans because, prior authorizations, you go to any doctor you want, all that kind of good stuff. But there is a monthly premium. So it's not for everybody. But the reason Medicare Advantage, and this is, people always, some people kind of cynical out there say, oh, Ed, the reason, Ed likes those Medicare supplement plans is because they cost money and they make more money. It's like, no, doesn't matter which one you sign up for me. But it's counterintuitive. That sounds like it's correct, but it's not. Medicare insurance agents and brokers make more money enrolling you in a zero premium plan for the most part, particularly when you're first 65, they make twice as much as a regular Medicare Advantage or a Medicare supplement. So yeah, it's the money. There's so much profit in the Medicare Advantage plans that the insurance companies are able to pay the agents pretty well. So for the Medicare Advantage, Medicare supplements, it's okay. But Medicare Advantage, there's more money in there for everybody. That's why they push Medicare Advantage plans. But again, it's the help is free. But the key is you don't want to be kind of steered in one direction. You want the person to listen to you. And if you have a budget and you can't do a Medicare supplement, then that's fine. Then, then get the best Medicare Advantage plan you can. And one of the things is a lot of them say they look at all the plans in your area, but if they're only licensed or they're only contracted with 3 out of the 5 in your area, they won't talk about the other 2. That's why I chose Chapter, because they talk about all of them, and the people that talk to you make no difference on how they get their money to to survive, to pay their their mortgage and support their family. It doesn't matter whether you pick a Medicare supplement or a Medicare Advantage or a plan that the company makes $0 on. It doesn't matter. The people that, when you call Chapter, they're 100% neutral in that case. That's why I chose them. So, all right. It's all about what is best for you. That is the most important thing. No money for 3 years, waiting for disability approval. Wow. Was approved for SSI, but they took it away from me saying that I made too much money in the last 3 years. Any advice? Yeah, so I'm not, yeah, that doesn't sound right, because if they approved you for SSI is based, unless you're 65 or older, I assume you're not. So SSI is based on disability. So if they proved your disability, that means your disability is approved. I'm not sure why you're waiting unless you're not insured for regular Social Security disability insurance. But in terms of SSI, because it is a welfare-based program, if you have more than $2,000 or $3,000 in the bank, depending on your merit status, yeah, then yeah, if you've got other money, because the most you can make on SSI this year is $943. So if you're making anything else or have any income resources, then yeah, you're not entitled for SSI. But I'm not sure why you're waiting for a disability approval. So we're talking for SSDI approval. Yeah, that doesn't make sense because you already approved for SSI. So yeah. If he makes $200 over the cap of 1860. Okay, I'm not sure what the question was there. If turning 62 in 3 weeks, my husband of 19 years passed 2 weeks ago. He retired at 62. I'm currently drawing SSDI. How much will I draw as a widow? He was 86. So yeah, it really depends on how much his benefit amount, and you can because he passed, you can collect survivor benefits now, because you can collect survivor benefits at 60, as early as 60, but you're going to be 62 in 3 weeks. So I would remember the survivor benefits. This is one where you can choose. Oh, okay, you're currently receiving SSDI. Okay, I'm sorry. So you're currently receiving SSDI. So you can file for the survivor benefits and add those on top. The offset. If you're entitled to $1,500 from a deceased spouse, and you're receiving $1,000 from SSDI, you'll continue to get your $1,000 plus the difference, which is $500 added on top of. And because you're going to continue to receive disability, your Medicare will continue and everything. So, yeah, yeah, call up now. It doesn't matter if 62 or not, because you're entitled to survivor benefits at 60. So call up and schedule an appointment and get that extra money if it's available. What happens if you get Part D, but then they don't cover a medication you thought they would? Then, yeah, then you switch Part D plans if you're able to. Most times you can only switch a Part D plan is during this period right now, October 15th to December 7th, and it'll take place. The new plan will take effect January 1st. However, you can ask the company for an exception. If you can't switch and you need it now, you just get your doctor to write a note to the insurance company and say, hey, I understand that there's other, medications out there, but, greedy gambler needs this one. And maybe they can make an exception for you. But if not, you'll have to switch plans. Widowed, 59 and a half. I'm destitute and need benefits now. Is there anything I can do to start receiving now? 59 and a half. At 59 and a half, from 50 to 59, which 59 and a half is still good. The only thing available is regular disability benefits. Well, that's available anytime. If you're disabled, unable to work because of disability, you can file for disability benefits. From 50 to 59, disabled widows benefits. If you were married to someone who passed, you might be entitled to disabled benefits based on their record. Once you hit 60, you can get just regular survivor benefits. And then at 62, just regular retirement benefits or spouse benefits. And if you go ahead and file for disability, if it's not enough, or you're not insured, or whatever the case may be, they will also take a claim for SSI, supplemental security income, to see if you can get any of that. And if you're approved for SSI, then you're categorically eligible for Medicaid from the state, so they'll take care of your health care. I would reach out to them anyway. If you're destitute, you should reach out to the state social services and apply for food stamps and Section 8 housing and Medicaid and everything you possibly can. So I did. Let me see here if I can find. I did a series of videos, um, and I kind of expanded the one on the bottom, how to live on Social Security alone. I went over about 40 different programs that might help you out. So watch that video. Go into my YouTube channel, just Google. Well, you know how to get my YouTube channel. So just look for that video, how to live on Social Security alone. I did a series of 4, and I apologize. The introduction, number 1, was way too long. But I've did another one like this. And so if you know anybody, the person, during in live Q&A right now, or anybody out there that you know that needs help, make sure you watch those videos with that person and see if there's anything that can help you out. And I apologize for my terrible YouTube, super long introductions on that one. But hey, just getting, Kaizen, getting a little better every day, I think. Brenda, am 64. I know Medicare supplement plans don't cover dental, vision, or prescriptions. Apparently, there are other items like foot orthotics that G or N don't cover. How can I review a G plan? If Medicare covers it, it doesn't matter, a G or N. If Medicare covers it, that's the most important thing. So don't look for a G or N based on, do they cover this, do they cover that? No. If Medicare covers it, then the G or the N has to. So if Medicare pays their 80%, the company has to cough up their other 20%. So don't even, look at your G or N plan based on that. So basically how it works is when you go into a doctor or you get whatever, the doctor, if it's, Part B, and, Part B pays 80%, and, you have to pay that other 20%. But if you have a Medicare supplement, what happens is the doctor, the hospital, whatever, sends the bill to Medicare. Medicare cuts their check for what they pay for, and then pretty much the Medicare computer system talks to your Medicare supplement computer company and says, yo, pay this money, and that's it, done. So Medicare pays it, then it's done. Whether Medicare pays it, I guess that's a whole different thing, right? There's a great app that you can download at Medicare, what Medicare covers. It's an official app. Make sure you download the official one, and you just type in, foot whatever, and it'll tell you whether Medicare covers it. And there's usually a lot of exceptions and stuff. So it's like Medicare actually covers dental. If you have like a terrible car accident, you have to redo your jaw and stuff like that, it covers some element of dental, but not like dental like we know it. But it's the government. Exceptions, the exceptions, the exceptions. So I am 66 and 1 month full retirement age. I think is 66 and 8 months. I have been on SSDI since 2021. So does that mean in 7 months I will be able to make any amount of income, right? Or is it 65? Your full retirement age. So starting with your full retirement age, you're going to switch to regular retirement, and regular retirement after your full retirement age, you're no limit whatsoever. And just between you and me, if you've never really worked while you're on disability, remember you have that trial work period. The trial work period is a 9-month period, not necessarily consecutive, but I would call Social Security and say, hey, have I used any of my TWPs, my trial work period? And they say, no, you haven't worked any of them. You haven't used any of them. And during those trial work period, those 9 months, you can make $1 billion a month. Social Security doesn't care. It's because it's a trial work period to see if you can go back to work. And then your trial work period just kind of transitions to complete freedom. So you didn't hear that from me, right? How to work the system. So just between you and me, right? I wonder if I can file ex-spouse benefits and keep working. He is retired. I work part-time, both are 65. Yes. Yep. Absolutely. You can, again, as long as you stand at the $22,320 this year, next year it jumps up to about $24,000. Yep. As long as you're under that, then you are 100% good. Anything over that, Social Security holds back $1 for every $2 you go over. Let's see. All the years my husband worked in construction, I got $50 of his Social Security. Wow. Yeah. So your benefit must have been high, or his benefit must have been low. Construction, A lot of work under the table type stuff. Yeah, a lot of people try to avoid taxes, and then so they don't pay into FICA and 1099, or they take a bunch of exemptions and whatever expenses. Sharon, chapter helped me find a more useful plan for 2025. Thank you so much. Awesome. Good deal. Yeah. Wow. They're knocking it out of the park. Awesome. I like it. Thank you for letting me know. I will be 62 in November and would like to start my benefits beginning January 2025. Do I have to worry about how much I make the month of December 2024? Okay. Be 62 in November and would like to start my benefits beginning 2020. No, not at all. You can make $1 billion in December. You're good. Um, you can actually start your, benefits in December, because you can't start in November unless you were born on the 1st, because you have to be 62 the entire month. So the first month you're entitled is December. If in December you earn under $1,860, you can actually start it in December. But if you start it in January, you just have to stay under the annual earnings limit. Spouse, thank you for answering my question. By the way, Derek was one of. Oh, okay, awesome. Good deal. Good deal. I like it. Oh, Angelo, thank you very much for the support. I appreciate it. You are awesome. 62, living on Social Security, disabled adult child collecting on my retirement. Instead of using my actual benefit, they are using the numbers for my full retirement as if I was getting it. Yes, that is correct. They always, the 50% and 75% in those particular cases are based on your PIA, your primary insurance amount, which is your benefit at your full retirement age. So yeah, if if you filed early at 62, your benefit amount is reduced. Your child doesn't get 50% of that. They get 50% of your full benefit amount. That is 100% correct. That is pretty awesome. So yeah, disabled adult child. So it'll continue. He or she will continue to get benefits for the rest of their lives if they're still disabled. One thing they can't do, they can't get married unless, I don't know, this is the law, unless they marry another disabled adult child. Two disabled disabled adult children can get married and their benefits will continue. But yeah, so there's that. My situation is so complex. I asked over and over, and I'm a unique case. I need help. Yeah, schedule a appointment. Click on the little calendar thing there, and we can do a 101. Or you can just kind of break your questions up and ask a little part here. You see a lot of people ask, 4 or 5 questions. So yeah, we can do that too if you want. Husband retired military, still working. His credit says 42. Mine says 40 work credit. Is it because he retired military? Yeah, it doesn't matter. No. Yeah, you got 40 quarters of coverage, 40 credits, 10 years. Yeah, so you're done. That means you're insured. That is not an issue anymore. As long as you're insured, you're not insured. But yeah, I don't know why his says 40. Yeah. But yeah, that's not an issue anymore. It's like you hit the finish line and nothing else. Everything else starts there. Let's see, Terry, can you get 100% widow's benefits at age 60? No. My wife died in 2019 and I'll be 60 in January. I live in Ohio and haven't worked since my wife died. I've been living on savings. No, your benefit will be reduced about 71.5% of the benefit amount of this. So yeah, you won't get 100% definitely until you hit your full retirement age. But it really depends if your wife was receiving benefits or anything like that. But no, if you start at 60, it's going to be reduced. If I can make ends meet when I turn 62, would you recommend I file for Social Security on my own and then on my ex when he reaches 62? Or is it better for me to wait? He made more than me. No, if you file, then you have to, it's called deemed filing in this particular case. If your ex-spouse is still out there alive and kicking, then you have to file for benefits at the same time. So survivor benefits, then you can choose. But once you go ahead and file, then you have to file for benefits on anything else you're eligible for. Yes, I was thinking about retiring a year or so. So my wife passed away a couple years ago. Who gets her money? I was thinking about retiring in a year or so. My wife passed away a couple years ago. Who gets her money? You, if you go ahead and file for those benefits. Please hit the like button. Thank you for your service. Yes, thank you. Yes, please press the like button. That's how we tell this stupid, these algorithms to send this information out. All right. Let's see here. How many years can a survivor spouse file after death? Surviving spouse, yeah. If you were married to someone, when you're 21 years old and you were married to them for 9 months or longer, and now you're 60 years old, you can file right now, 60 years old. I began collecting Social Security after my husband died, 66. I was 64, now 65. Can anything change? No. If you continue to receive Social Security benefits, no, nothing pretty much will change. Now you're 65, you're entitled to Medicare, so you definitely need to check out Medicare Part A, Part B, unless you have other health insurance from work and your employer has 20 or more employees. But if not, yeah. But if you're already receiving Social Security benefits, then Medicare will automatically sign you up for Part A, Part B. Now you just need to figure out what you're going to do to cover all the gaps. And if you want, you can call my partner and they can help you out and get you everything you need. All right. Wow, we're way out of time here. Oh, Terry, thank you so much for the support. Wow, y'all are awesome today. I got my coffee IV for the rest of the week. All right, let me get to someone I've never seen here before. Honey Lemon. I don't think I recognize Honey Lemon. I am 70 and getting Social Security benefits now. My husband is 63. We have a rental property income. Did you say it would not count as income? Correct. Does not count as income. Let's see here. Who else do I don't? Nancy Smith. Do I recognize? Okay. I'm 77 deaf widow with heart failure. My supplement is very good, but I can really afford it anymore, but I can't do without it. I draw about $100 too much for SSI. I'm 97% deaf. Yeah, that's unfortunately one of the things with supplements is it does have, the monthly, cost. Um, Maybe depending on your state, sometime you can change supplement plans without underwriting. Um, so you can reach out to my people and they can help you out. I'm sure they have a TTTY line. Um, but Yeah, some people just go ahead and when they can no longer afford it, they switch to a Medicare Advantage plan. But I would definitely, make sure you're making the right decision in your particular case. But maybe they can find you something cheaper, because being deaf does not. Oh, you have heart failure too, yeah. So in most states, you wouldn't be able to switch plans, but some states you can. So and there's special situations. So yeah, those are your options basically to find a cheaper Medicare supplement plan or go ahead and switch to a Medicare Advantage plan. And The $100 more over for SSI, hopefully, because those numbers change every year. So if you haven't checked that in a few years, the $100 over 2 or 3 years ago might be good now. So definitely check that and definitely check it, in November because the very small COLA increase and maybe you will be eligible for SSI for Medicaid starting in January. And if you get Medicaid, then yeah, that'll definitely help you out. And then you can go ahead and basically suspend or cancel your Medicare supplement plan. All right, we're completely out of time. I will be back on. Wow, I've got so many questions. I apologize. We're out of time. Please cut and paste your question and save it. And I will be back again tomorrow and pop it in there first thing. And I guarantee I will get